Hi, this is Monday today, and we are on Men's Monday. And the topic of discussion today is the body issues that men face. Men don't talk about it, but they face it. So, yes, welcome to the live today. It is Monday, and we are talking all men with Dr. Karishma with us. And we would shortly begin our discussion. And I am viewing the request. I'm going live, Dr. Karishma, right now, and we will discuss. You know what happened? I sent out uh, the request. Hello and welcome, Dr. Karishma. Thank you
Hi,
for
good evening.
thank you for being here, and thank you for being, standing up for men and talking about the issues that they don't talk.
Right. Yes.
So, doctor, can I tell
Yes,
you one
I'm
thing?
I'm very happy to be here.
So, can I tell you one thing, doctor? What has really happened is when I sent out the stories, I got in a lot of
Right.
replies saying that, hey, I want to ask this, but kindly don't announce my name. You know,
Okay.
so men,
Okay.
what I think and what I know is men want to discuss the body issues, but they don't want to do it openly.
Right.
So a lot of times I'm on the
Yes.
news saying that one of the users or one of the followers have asked this. I will not use the name this time.
Right. Absolutely. No, definitely, we will keep, the names confidential, and definitely there is a hesitancy amongst men as compared to women, that they don't want their names to be revealed, and that's the issues. But yes, let's jump to what are the kind of questions that you received. I received a few questions, and I had discussed with you, so I've sent you those questions, and let's go ahead and let's see what are people looking for and what are they concerned about.
Yes, so the first and foremost, and I've received this a lot, is is the discussion on moves. For some reason, a lot of people have referred to as male breast, but I know there's a good medical term for it. Um, you know, they've asked me questions on saying that how can I really get rid of it, and they've tried gymming, they've tried toning the chest muscles, they've tried not eating a lot of things what they've been have been told to them, but it's not really helping, doctor. So I think this is the first thing that that I should pick up, because there's a lot of messages on that, and they don't want to be named. At least six is what message that I got. They wanted to know that they are
Right.
worried about it, and they've
Yeah.
been trying since a very long time. So this is the first body issue that came to me that men are asking.
Right. So, just to let everyone know that what Naved said, the moves or the male boobs, that is the recent terminology which was put across in the dictionary and it came in the dictionary called the male boobs. But the medical term for it is gynecomastia. So, it's male chest gynecomastia. It is nothing but an abnormal enlargement of the male breast tissue. So the guys, you should know that when we are born, both the boys and girls self has a breast tissue behind the nipple area. But as we go into puberty, in the females, the breast tissue enlarges due to the effects of the estrogen and progesterone hormone and forms a normal breast. Whereas in men, because of the testosterone spurt, there is a regression issue. But in many boys, there are abnormal hormonal changes which happen during the teenage years and the pubertal growth spurt. And that's why this abnormal hormonal imbalance is the commonest cause where most of these young boys at 13, 14 start noticing this lump behind the nipple. So the common signs are nipples feeling puffy, so puffiness in the nipple, a slight bigger growth behind the nipple areola region, and it keeps growing as you grow older. If it's very commonly seen in obese people, but sometimes in the younger age, they tend to work out and lose their baby fat. And then we kind of differentiate, is it just fatty tissue or is it actually gynecomastia? And some of them try to lose weight, they work out and they say, I still feel a lump behind the chest. And then it is a true gynecomastia. So commonest cause is actually no cause. It is just an abnormal hormonal change. And some people say, I'll test my blood and blood profile is absolutely normal. So it need not, this hormonal imbalance need not show on your blood profile also. So obesity, hormonal imbalance, some people who take long-term medications related to heart disease, liver disease can also get it later in adulthood. That is very common after 40, 50 years.
Right.
And some people, there are a lot of trainers, bodybuilders who take long-term steroids. And we very commonly see gynecomastia in steroid intake people.
Right. Right. Yeah. So doctor, what you're saying is that yes, there's a solution to it, and there's a surgical solution to it. Is that what I hear? Right?
Yes. So the is to go for a liposuction. Liposuction is the treatment for gynecomastia. The thing is, it's a very simple procedure. I don't know if you guys should get scared. Don't think of it as a surgery. You know, it is small keyhole incision literally made inside your armpit. So it is made inside the armpit, and in about half an hour, 40 minutes, we can literally break the gland using the liposuction device. And I use the Vaser high frequency ultrasound. So the gland tissue can be in fact very gently broken, and it's emulsified and suctioned out. So it's literally half an hour to 45 minutes, almost invisible scars which are in the armpit. You can go home the same day after the procedure. But we tell them to wear like a compression waistcoat. And this compression waistcoat is worn for at least 3 to 4 weeks in order to give you that final shape and allow the swelling and everything to take care. And these are almost permanent results. You know, we usually do not see recurrences.
All right. So related to this, doctor, you know, while we are on this this topic as well, Rohit Kumar, if identify Rohit, if you're there and looking at this live, he's asked me saying that who's the ideal candidate for a six-pack ab surgery? You know, people want ab surgery. Can it be done on someone who's overweight? Does it need a certain BMI? If it cannot be an overweight person, what could be the reason? You know?
Right. So I think this is a wonderful question, very much to the point, and he hit the button at the right spot. Very important. A six-pack surgery is for those people who are normal BMI or within near normal BMI range. That is, say, between 25 to maximum 28 or 29. Okay. So these are individuals who, ideal candidate, they are already exercising. They have a good lifestyle routine, good workouts, and they are on a moderate diet, also a healthy, reasonably healthy lifestyle. And they have been working out like forever and just not able to get that final definition. And they are just looking for those cuts and, you know, in the midline of the abdomen and the oblique cuts. And those men and women are the ideal candidate to undergo for a six-pack surgery because they just have small stubborn pockets of fat. You know, it's for a person who's obese. Remember, if their BMI is more than 30, they do not fall in the category of a six-pack surgery. Why? Because they just don't have fat underneath skin. They also have fat intra-abdominal. That is the fat which we accumulate due to a bad lifestyle. And, you know, you have that, you know, in men, we say that pot belly appearance. You know, like a rounded tongues, you know. So that can only be first taken care with diet and exercise. So I tell all my patients, if you're on the obese side, first you need to diet, exercise, try to lose as much of the intra-abdominal fat. And then we can look at these six-pack surgeries and body sculpting procedures because we are just removing the fat underneath the skin. We are not going internal, right? So the ideal candidate is someone who is fit, medically, physically, very close to your normal BMI, say maximum 28, 29 or 30, and has reasonable stubborn pockets of fat covering the muscles and you're not getting a muscle definition and they're working out really a lot. So they are the ideal candidates.
All right. And so, I mean, related to this topic, Jeet Devaya, the strength coach, you know, also wanted to, you know, come live with us. I'm looking, I can't find him. Is he live?
Really?
Are you live?
Is he live?
So
we were waiting for him. He said he'll come around 6:10, 6:15. So to briefly, you know, Jeet is He has sent you the request. I just got a message for him. So you need to accept. Just look for JD_performance.
Yeah,
So everybody,
I have ProCare request. Yeah, yeah. Followed by
yeah, ProCare.
ProCare.
Yeah, ProCare.
Oh,
Yeah,
different ID.
yeah.
Yes.
So ProCare, Galen, Jeet is a friend. He is my fitness coach and he trains me. And for everybody, for our audience out there, we have Jeet from Pro Galen
Hi.
Fitness. And
But
hi, Jeet. Hi.
I,
there's
I,
no net here. There's no internet.
okay,
We can hear
that's
you. We can hear you.
we can hear you. That's a universal problem. We all it. But the problem here is men usually talk about it, and it's bad is the pack. And we were discussing about that topic right now. We just discussed
Yeah,
gynecomastia
yeah.
now on a six pack, and we wanted to have a perspective from a strength coach, because people might be coming to you and hounding you saying that I want six pack, in maybe 1 month or 3 months or 6 months. I don't know what. So what's your take on
Leave a doc add on.
who actually faces the maximum burnt?
Yeah. So what doc told, I'll try to add on, rather than taking the shortcut method, where people, we all know what they do, taking some, your testosterone boosters, or which affects the internal organs. This is a superficial keyhole. You're out on the same day, and probably 10 days of maintenance, and then you're back to normal. And
But tell
maintaining a
me,
health.
Jeet, Jeet, most of my patients nowadays, I send them, if I feel they are not a candidate for body contouring, liposuction, most of my patients go to Jeet. Jeet, what do you feel? Is this the right approach? Is it okay to do a liposuction? There are many trainers liposuction, and
You know what? From a fitness
obviously want
trainer's
you
perspective,
to.
you know,
From your fitness trainer's perspective, do you think it is okay to do the body contouring if they are just not getting the results, and when to go for it?
I'm definitely okay. As I told you all very clearly, between the devil and the deep sea, I would go to the deep sea. The devil is temporary, taking your shots. And then if you don't get back to the proper cycle, then there's other repercussions. So rather than that, go for this. I think these days, most of them are scared that, getting a surgery, getting liposuction. So I think it's not like before, with the latest equipments and qualified and knowledgeable doctors, therapists in the field. So I don't see any harm in going and getting this done, Navid.
yeah.
Not a shortcut, but definitely the right way. If you are not able to get that last pocket of fats, as Doc was discussing about earlier, if you're not able to, that's fine. There's nothing, no harm. And you don't have to feel ashamed, or you don't have to feel you've done something wrong. It's at least better than taking the injections.
Yeah. So what I hear,
Right.
My point.
So, Jeet, tell me, like gynecomastia, I have a lot of patients who come and with the gynecomastia, and they are gymming, they're working out, but there are many trainers, they believe, my trainer believes that the gynecomastia will go with workouts. Is it possible as a strength coach, and if you have seen patients who have a well-formed hard gland, do you think the workout will take care of it?
No, especially not the gland, definitely no, because in your strength training, we don't have a particular point of exercise. Say if I am working on my pecs, I cannot pinpoint on that particular area and say that this particular exercise will work on that particular area, and probably your fat or whatever will disappear. No, that's not possible.
Right, right. Yeah, so as we
Yeah,
tell, we make sure that if they are having gynecomastia, do your workout. It will help to remove the fat portion and reduce the
correct.
fat portion of the chest. But the central gland portion ultimately needs a procedure, you know.
Yes,
And again,
yes.
Navid, I'll tell you, even after my liposuction, that's just 40% of the job. Jeet takes care of the rest 60%. So for all the viewers, hear it from the trainer. Liposuction is just one aspect of it, but the final and best results come when they go to Jeet and start the strength training. So please tell us a little bit about the importance of strength workout with procedures.
They feel Dr. Karishma has got a magic wand. Okay?
Does, but
the minute she touches, she does. Karishma herself is that magic.
Yeah, so yeah.
But then,
got to have Karishma, yes.
Correct. But then she can only do that much. Okay? But the rest is, the onus is on the person. It's on me. Okay? Whoever is doing it. Okay? So they should follow a healthy lifestyle. They should exercise and maintain a certain discipline in life. Only then there is a complete result which one can see. So I come across a lot of people, oh, she did this, but then we've come back to normal. Yeah, she did that, but then have you followed a lifestyle? Have you been regular with your exercise? You've not been eating junk. See, it doesn't mean that you need to stop everything, but then you be aware of what you're doing.
So
that's what I would.
The post-requisite, is there a prerequisite as well? Can a overtly obese person come out as Tiger Shroff from Dr. Karishma?
No, absolutely not.
As I definitely mentioned, you need something, You need a proper rock, right, to chisel an idol. You just can't take some rock and say that I'm going to chisel an idol. Yes, it is a rock, no doubt. But then, if there's a crack in the rock, so once the artisan, he tries and chiseling the rock, there will be a break. So the same way, that you need some substance to work on it.
Got it.
Yeah, and Navid, so I say a complete no to those individuals who are above 34, 35 BMI, who come for a liposuction. I just want to reduce my tummy. There's no point. See, the first and foremost aspect of body contouring, that is liposuction, it is not a weight loss procedure. So everyone needs to know that it is only a method of body contouring, that is removing pockets of fat from areas to give a better definition. You will look more contoured in that particular area or thinner in that area. But if you are highly obese with a very high BMI 35, then they have to look at weight loss procedures like bariatric surgery, or look at a very stringent diet and exercise. Reduce your BMI, and I tell them, come to me after 6 months and then let us look at the contouring. Because how much ever fat you remove, fat is hollow. It cannot be weighed when it's outside the body. So you do not see any change on the weighing scale. You will just look contoured in the area.
Right.
The weight reduction happens once they're dieting, few months later.
So advice to whoever is wanting to contour, their bodies is consult you on what their current fitness is. Consult Jeet, or somebody who is training them as well on what their current fitness is. Then come to that level and then come back to Dr. Karishma, right?
Yes, absolutely. Yes.
That is very informative, because otherwise people also think that, hey, surgically probably there's a magic that can happen. So there's no shortcut to looking fit and being fit as well. Both are related.
No doubt.
Yes. Both complement each other, and both are equally important. And the results of whatever we do can only be maintained with your lifestyle. So couple of years later, if you let go of your lifestyle, you start binging. Initially, you may not gain weight in those areas, but finally, new fat cells form, the fat cells enlarge, and gradually you will start gaining weight. However permanent this procedure is, it is as permanent as you keep it. So you can keep it forever as long as you're maintaining it.
All right. So I think we have the answer. There's one big issue as well, and I've asked that a lot of times, is on the nose. Now that.
Okay. So Jeet, hi. So any last few words that you have to say, because now we're going to continue with other topics related to skin and everything.
nothing, there's no shortcut, as Navid very clearly mentioned. It is a combination, a catalyst. Maybe once you get this procedure done, maybe it's a small reminder that, hey, don't do this, don't do that. It gives you a small awareness. But yeah, I think you guys are doing great. So Doc, keep what you're doing.
Thank you.
Yes,
Yeah,
and thank
Navid,
you so
again.
much for joining us, Jeet, and giving us your expert opinion. Yeah,
Really,
I will see you soon.
yeah, we needed that perspective. Though I'm into fitness, but it coming from a coach makes a lot of sense. And thank you so much, Jeet, for this.
Yeah, Jeet is my fitness coach too. So all
Okay,
of you guys looking for that expert opinion.
I'm taking your contact and coming there.
Yes, yes. Pro Gallon. They are in Jayanagar as well as in Indiranagar. Yeah. See you, Jeet. See you soon. Thanks for joining us.
Bye.
Yeah. Bye.
All right.
So, Navid.
Doctor,
Yeah.
come to the nose. It's come.
Yeah.
A lot of people are worried. A lot of men are worried about it. And a lot of people, I mean, there are two of them, they said they're about to get married, and they would want to enter the married life with a better nose.
Okay, okay. Well, it is a very common concern. Many people are conscious about, the nose, and they are very self-conscious about the way it looks. I think in India, most of the men who come to me for a rhinoplasty have a very common concern is either their nose bridge is too wide or the tip is very bulky or bulbous. And sometimes even the base of the nose is like too wide, So these three issues are probably the commonest, and some of them have like a hump, like we call it a hump on the nose bridge. So I think these three or four are the commonest thing. If you are planning a rhinoplasty before your marriage, just remember, have it done at least 6 to 8 months prior. I mean, do not plan it 1 or 2 months before, because the nose, unlike any other part of the body, is very delicate. The bones are delicate. It needs a healing time. So there's an initial 4 to 6 week healing period where the bones and the cartilages settle in the new position, right? The scar is a tiny scar at the bottom, and we want it to fade off within a few months. And they say that the best result of a rhinoplasty or a nose job is at 4 to 6 months. Because there is a lot of microscopic swelling, which always happens, especially the tip of the nose, So I tell all of them, when it's rhinoplasty, please have patience. Allow yourself a good 6 to 8 months before your marriage, and you will see the best results at the end of the day. If you're planning it 1 or 2 months before, I straight away say, please don't do a nose job 1 month before your marriage. You're going to have swelling. It's still going to look bulky.
Yeah, it's a bad problem to have. Imagine you're getting married.
Sorry,
I'm saying it's such a bad problem to have, saying that you're getting married and you're telling to your wife, please don't touch my face. That's a very bad thing. So yes.
No. I mean, that's not possible. I mean, the bones are really, in fact, people who are into sports, we don't allow them to even do gym and, heavy duty sports for 6 weeks because the bones are still healing. And we say, be careful, you can knock yourself and, it shifts again. So, please give yourself a good 6 months at least before you get married. To do a rhinoplasty for sure. And a rhinoplasty is a very technical procedure, needs planning. You need to consult us. We have to do a CT scan. We need to understand. A lot of them even have breathing issues nowadays. It's not just aesthetic, but even breathing issues. So in case people don't know, to correct the breathing issues, we have to do an internal correction called the septoplasty. So that is a septum in the internal part of the nose which gets deviated and moves to a side. So sometimes they have recurrent nose blocks or breathing issues. So sometimes a rhinoplasty is combined with the septoplasty to treat their breathing issues also.
That's a great one, because I know few people who have the breathing issues and they've been contemplating, what to do about it. So that's a great addition.
And also the other way around, they can just do a septoplasty. We have an ENT surgeon who comes to our clinic and she's, looks at that. And if someone is not looking for an aesthetic correction, then they can just do a very simple 40-minute septoplasty, which is done making an incision inside the nose. So it's like a closed procedure. No opening up the entire nose, yeah?
That's great. So I mean, these are the three big ones. But besides that, doctor, if you have got certain, questions on your handle, you can, address that as well. But some pigmentation issues, some underarm darkening,
Yeah.
these are random questions that
Yes.
all this while before this initiative as well. So over to you.
Yeah, so I got a question talking about pores on the nose and the cheek, and that this person has done a CO2 laser. It has not worked too much. Now, there are, just to let you all know, when it comes to pores, no one can get rid of pores 100%. I mean, I have pores, you have pores. It's just that they're not prominent because they are in a shrunken position. And, we regularly, I do like cleanups, medifacials to keep the pores in control. My pores, if 3 months or 4 months, I don't do something, especially for me, it's like under the lip area and the nose, and the pores start looking big and they look like dot, 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 and all those whiteheads pop up. So see, for your pore shrinkage, you need a good medifacial at least once in a month or once in 2 months. If the CO2 laser didn't work, then you can think of microneedling, radio frequency. Also, you have to do regular sessions. One session is not going to show you results. And not many people know that, we use even dilute Botox to shrink pores. So these pores are more prominent in those people who are acne prone, have very oily skin. So they constantly are not doing treatment, so those pores get enlarged. And sometimes we can inject a little bit of Botox underneath these pores. And what it does, it shrinks the sweat glands and thereby shrinking the pores. So that's what Botox can be done for also. So I suggest you meet your cosmetologist again or visit our clinic and let us see how your pores are and work on a new plan for you.
All right. So, doctor, you need to actually see people in person to be able to advise on this, right? Or is there?
Yes. So when it comes to the skin, especially the skin, in person is always a better way of us assessing the skin type and knowing what kind of skin they have and what products would suit them and not suit them. So the other question I got, and is the commonest problem among men, is hair fall. Which is the best anti-hair fall shampoo is what somebody asked. Hair fall can be treated not just with an anti-hair fall shampoo, but many times you need to treat it also with certain oral supplements. So oral supplements, when you choose it for your hair fall, should have a good quantity of biotin, especially zinc, folic acid, and amino acids. So meet your doctor, and the common brands that we use here are Polyhair. There is a BTN Ultra. There is Renocia. These are very common brands available in most pharmacies. Please start your hair supplements along with certain scalp serums. Now, this is better you don't take and buy off the counter. Better you come visit the doctor. And depending on the severity of hair fall, we give you these. If it's a very severe hair thinning and the person is starting to bald, then we give them these minoxidil-based and finasteride-based combination. So that has to be given with a prescription. Otherwise, you can use just for maintenance peptide serums like Qcera or Renocia serum or Anaboom. These are a few brands. And anti-hair fall shampoos, the commonest one is Sebamed is very good, revitalizing. There is Anaboom. There is a Renocia shampoo. These are all which are fragrance-free, sulfate-free, paraben-free. And recently, I actually, went to this new salon which is open Desange, and they had all these Kerastase products. And normally, I try not to go for these commercial brands, but I actually managed to find a Kerastase brand, and it was sulfate-free. So if you choose your shampoo, try to have it pH balanced, try to have it sulfate-free as much as possible. And those should be good for anti-hair fall. If you're looking at very thinning and you're starting to visualize your scalp, please go and start some PRP treatments for your scalp. So the combination of the scalp serum, your oral supplements, and PRP on a monthly basis, within 6 months, you should start seeing thickening of your hair and new baby hair growth. Yeah.
So, men and hair, it's a altogether big different topic because we're coming to the end of the entire thing. I want you to dedicate this session, doctor, to men and hair. The hair fall issue,
Yes.
too many hair issue,
Yeah.
beard issue, the growth not happening in way.
I think we should,
Our
that should be discussed in a complete separate section. I think so.
think it's a separation altogether. I think men and hair.
Yes.
Let's pick it up as a different topic because there's so many questions on it.
So much. Yes.
Overgrowth, undergrowth, all that.
Yes. So the last question I got was underarm, dark underarms, very common amongst men. What can you do? Well, important is if you're on the heavy side, we say try to lose weight. Obesity is one of the reasons for the pigmentations on areas like underarm, back of the neck, in your intimate areas, inner thighs. And it happens due to excessive sweating, constant friction and rubbing. So please, if you're, sweating too much, try to use these, powders like Adsorb or nice and simple Nicel powder. Try to keep the underarms dry. The best way to treat dark underarms, you have to go in for chemical peels, on regular monthly basis. Along with that, we have certain intimate areas, sensitive topical moisturizers. So these lotions help to depigment to some extent, but finally it is chemical peels which finally gives you the result. So if it's a pigmentation which has recently in a few months come up, then you can get rid of it 100%. But if it's like very dark underarms, very thick skin for years and years together, then sometimes we cannot assure you 100% lightening, but definitely about 50 to 60%. So it all depends on what condition and how severe that pigmentation is.
All right. So thank you, doctor. I mean, there is another question, but we'll not pick that, Rohit. Right now, your question on PRP and QR678.
That will be I think the next session after the fortnight will be on hair only.
Yeah, we will pick that later. And just wanted to thank, take this opportunity and thank to, doctor for actually coming and addressing the overlooked men and the issues, including body. Because, like I said, a lot of men actually want it. But for some reason, probably because of the way society has labeled men to be not conscious about their beauty, to be seen as feminine when probably they think about how they look and and the fake what you say being macho, saying that hey, I will work out, I will try and work it out and see how it happens. Never ask for the direction. So I think these are some men issues that are at a psychological level, but this is not the forum for that. But the attempt has been on Men's Monday to bring these topics out. So at least you start the conversation with us on your direct messages or directly talking to us. We will talk it out, as embarrassing as it is. You might think it is. We'll talk it out here. Please keep sending your queries and questions to doctor or to me. And we will pick this up on Men's Monday and try and address it. Like I said, as embarrassing as you might think, we'll keep it anonymous, but we'll discuss it right here. And thank you so much for this forum and for this opportunity. I've been swarmed with these questions all this while, but I had really no outlets to, or an expert to come and actually talk about it. So thank you so much.
I'm enjoying the sessions, and it is something that I also have never done. So addressed only for men or men's issues. So it is a great opportunity, and thank you for making me a part of it. And we're going to have lots more of these sessions. But for all the viewers, Navid is going to, obviously, we're going to save this Instagram live. And I want the viewers, we are going to have a prize just like we had a winner last Friday. The person who shares our Instagram live session, saves it, puts in a comment to the live session and shares the whole post. We will select a lucky winner, maybe 2 lucky winners, and I'm going to announce it on Friday. So Navid is going to save this live and I'm going to repost it. So on any of our channels, either his or mine, please comment on the Instagram live session. Please share it or save it. And we are going to choose 2 lucky winners on Friday, and we're going to announce them. They're going to get a super cool free cosmetic skin treatment or hair treatment, whichever you choose, at Dr. Karishma Aesthetics.
I
So
want
you need to first.
you to doctor.
So yes, please share it as much as you can, and all those who comment, share, and say, we're going to select 2 of them and announce the winners on Friday.
All right. So Dr. Karishma and me signing off on Men's Monday. See you soon next week.
See you soon. Bye.